Hi, this is Dr. Hesch, a physical therapist at Hesch Institute in Aurora, Colorado, and I'm presenting on a pattern of bilateral inflare of the ilium. And in this pattern, it appears that both ilia have gone anteromedially, and another way of saying that is that the sacrum has come posteriorly and become stuck. In that pattern, it appears to wedge the sacroiliac joint on both sides, and there's no mobility in any direction with the passive spring tests that I've described elsewhere. Regardless of the direction, there's no mobility. It's a very, very rigid presentation. And there are two things that cause this bilateral inflare. And one is a fall onto the buttock, such as if someone pulls a chair out from under you, which is not funny. And when the person lands on their ischia, the trunk bends forward, and it appears that the SI gaps perhaps at impact, and the hyperflexion of the trunk pushes sacrum posteriorly. The other mechanism for causing a bilateral inflare with the posterior glide pattern of the sacrum is delivering a large baby, having a difficult birth. And with this pattern, the ligament that connects sacrum and ischial tuberosity, the sacrotuberous ligament, and the sacrospinous ligament become very, very tight because, again, sacrum has wedged posteriorly, and therefore those ligaments become very tight. The treatment is very straightforward, very simple. And I use this 2" by 4" by 8" foam, and I place it on each side under the ilium, under the anterior pelvis, and I have the client lay on that for 5 minutes. And after that, I add another 5 minutes of them lying on the foam, and then I add a very gentle anterior glide to the sacrum, encompassing the upper 3 sacral segments, S1, 2, and 3, and the pressure's right in the midline. And this works very, very well, very effectively. And it's a pattern I see somewhat frequently, and it's not described in the body of literature. It is described in my book, which is called Treating Sacroiliac Joint Dysfunction and Lumbopelvic Pathomechanics, Integrating the Sacroiliac Pelvis, Lumbar Spine, Hips, and Symphysis Pubis. And I hope this is informative. Thank you.